to combat combat vaccine preventable diseases, including the global campaign to eradicate polio. However, in June of 2021, Rotary and its GPEI partners launched a new 5-year polio eradication strategy. The approach outlines new tools and tactics to reach more children with polio vaccines while also strengthening health systems in underserved communities. This new strategy has 2 main objectives. The first is to interrupt transmission of all poliovirus, wild poliovirus, and vaccine-derived poliovirus in Afghanistan and Pakistan, and to interrupt the transmission of the variant or the vaccine-derived poliovirus in outbreak countries. This strategy centers around several key areas: political advocacy to create greater urgency and accountability in the endemic and outbreak countries, improved engagement with high-risk communities, improved operations and polio surveillance, and including polio immunization in broader health programs. As part of this new strategy, Rotary and its partners are using a new tool, the novel oral polio vaccine, NOPV2, to help address outbreaks of that variant-derived poliovirus. It has been deployed in a growing list of countries and is a promising development in our quest to end polio once and for all. This vaccine protects children against polio while being more genetically stable and less likely to regain strength and cause the variant-derived polio virus. The new vaccine is being deployed in a growing list of countries, and it is our best tool for achieving eradication of the wild polio virus. It's a safe and effective vaccine responsible for eliminating over 99% of polio cases worldwide for the last 30 years. Next slide, please. So the 2 endemic countries that remain, Pakistan and Afghanistan, a few updates here. In recent years, Pakistan experienced a spike in cases of wild polio, but in 2021, it reported just 1 case, down from 84 cases in 2020. There were 30 cases of wild poliovirus reported in Pakistan last year. However, to date this year, there have been 2 cases reported. And in 2022, at this same time, there were 13. So we've seen improvement there. And this is the busiest time of year, or the most common occurrence happens during this time of year. The country has seen a dramatic reduction in cases of wild polio, and polio surveillance data confirms this progress, with significantly less virus being detected in the environment. Challenges in Pakistan include poor campaign quality, insecurity in mobile populations, politicization of the polio program, and in some cases, vaccine refusals. The government of Pakistan has responded to the serious challenges facing the polio program and has reassessed its strategies to stop polio. It's implementing an emergency plan and deploying new tactics to strengthen essential immunization, better target high-risk areas, and integrate basic health services to complement polio immunization activities. To address vaccine refusals, tactics include tailoring strategies and deploying appropriate community influencers based on a family's specific reason for refusal. The program is also emphasizing communications activities to combat misinformation, improve trust, and better communicate the importance of polio eradication. Rotary continues to hold workshops for religious leaders throughout Pakistan to help to communicate to vaccine-hesitant communities about the safety and importance of vaccination. And then we've done a couple of things there as well to help complement the polio eradication strategy, including establishing 20 solar water filtration plants, because we know clean water access makes a big difference. In April 2022, the new prime minister in Pakistan convened a meeting of the district commissioners of the highest risk districts in response to the detection of a wild polio virus after nearly 15 months of no cases. And the Rotary was represented by trustee and National Polio Plus Committee Chair Aziz Maman. The Prime Minister has also convened meetings of the National Task Force on Polio Eradication to address this situation. And then in Afghanistan, just 4 cases of wild polio were reported in 2021 compared to 56 the year prior. In 2022, so far, just 2 cases have been, or just in 2022, just 2 cases were reported. And to date in 2023, we've seen 5 cases reported. Not only has the country seen overall a dramatic reduction in cases of wild polio, polio surveillance data confirms this progress, and it's significantly less virus being detected in the environment. Insecurity and access issues continue to leave children vulnerable to the virus. However, the polio program in Afghanistan has operated for many years during insecurity, excuse me, and escalating conflict, and will continually adapt to the nature of the situation. The current situation presents new challenges, but Rotary and our partners' commitment to end polio is unwavering. We're committed to continuing working with all stakeholders to finish the job. For the first time in over 3 years, we have access to all children in the country, although some continue to reside in difficult to reach areas. Despite difficulties, the GPEI has maintained polio surveillance across the country over the years and continues to do so. Let's see, we can go to the next slide. So progress in 2022 and 2023, but polio virus is circulating in limited geographic areas around the world. There are now only 7 subnational areas that account for 90% of all new wild and vaccine-derived polio cases worldwide. Even though we saw a slight uptick in wild polio virus cases last year compared to 2021, the wild polio virus is circulating in very limited areas. The circulating vaccine-derived poliovirus type 2, or the variant poliovirus, remain largely the same in 2022 compared to 2021. So these 7 subnational areas we're calling consequential geographies. They are affected by complex humanitarian emergencies. They are prone to repeated polio outbreaks that can be difficult to control, and they often export poliovirus to neighboring countries. They are also home to some of the largest populations of zero-dose children. So that's children that are either or under vaccinated. And those consequential geographies include Eastern Afghanistan, Southern Khyber Pakhtunkhwa, Pakistan, the Titi province in its hinterland in northern Mozambique, the Eastern Democratic Republic of Congo, northern Yemen, northwest Nigeria, and south central Somalia. The Global Polio Eradication Initiative, or the GPEI, as you've heard me mention, is developing tailored strategies to implement in these 7 consequential geographies, which include offering additional services, conducting multi-antigen campaigns with polio and other vaccines, such as measles, increasing environmental surveillance sites to quickly detect the virus, and working to increase routine immunization coverage. So with just 7 cases reported in the 2 remaining endemic countries this year, we have a renewed opportunity to epidemiologically stop wild poliovirus transmission. So there's progress in the endemic countries as well. So only 2 of 34 provinces in Afghanistan reported cases of wild poliovirus last year, and only 7 of 171 districts in Pakistan are considered endemic for wild poliovirus transmission. We have intensified efforts in both countries to reach these historically low numbers of the biologically distinct virus lineages remaining in circulation, demonstrating the effectiveness of our strategies. Although the number of cases is down from last year, experience tells us that even 1 case is too many, and polio has repeatedly shown that it's one of the most difficult viruses to eliminate. The global community, including Rotary, pledged $2.6 billion toward fully implementing the strategic plan at the Global Polio Eradication Initiative pledging moment last October. And this year is critical because the GPEI is aggressively working to achieve two significant milestones that I mentioned before. So interrupt the transmission of wild poliovirus type 1 and report the last case of the vaccine-derived poliovirus in outbreak countries. Earlier this year, I guess earlier this month, there was an independent monitoring board report that's being currently created where they are evaluating our progress in those two areas. And we're still waiting the official results from that. But it sounds like we might be at risk of interrupting wild poliovirus this year. And we may not reach that reporting the last case of the vaccine-derived poliovirus. So we're running a little bit behind. The COVID pandemic certainly did not help us in our efforts to reach this goal, but we're currently waiting the official results of that report, and we will sort of reevaluate and see where we are based on things there. But we're definitely continuing to see progress. So this year, Rotary members must really aggressively pursue the achievement of those two milestones and leverage our strengths and elevate our fundraising, our advocacy, and awareness raising efforts as one of the core partners in that global polio eradication initiative. So that includes donating to the End Polio Now campaign. We have, of course, the Bill and Melinda Gates Foundation match of 2-to-1 up to 50 million. We have the Polio Plus Society in clubs or districts to deliver on our promise of a polio-free world. Also advocating, so contacting global government leaders and encouraging them to prioritize financial and political support for polio eradication. Raising awareness with media, contacting them and alerting them of the role of Rotary in polio eradication efforts. Participating in World Polio Day on 24 October, and engaging Rotary members. So ensuring that every club member is aware of the opportunity to be part of history and take action to eradicate polio. So that's a lot of background into why this is important, but it felt really necessary to set the stage. We can go ahead and move to the next slide. Thank you. So we have quite a few audiences that we are working with, both Rotary members and just the global community as well. And so we worked really hard to identify who our ideal audiences, because we know that effective storytelling starts and ends with knowing who we are speaking to. So different audiences respond to different messages, and we need to define them beyond demographics, including their familiarity with the topic, in this case, polio, cultural background and language, and getting curious. What are their barriers to donating, or their barriers to helping to raise awareness? And uncovering the insights that you can create content to connect to. This will really help you choose a story that resonates with them and makes an emotional connection. Our Rotary marketing team recently did some research that shows us markets such as India, Nigeria, Philippines, and Brazil have both high levels of awareness of Rotary and understanding of the work that Rotary does. And other markets such as Australia, US, Western Europe could benefit from initiatives that focus on increasing understanding. But we also know that word of mouth from current or non-members is really the main way that those who are aware of Rotary have heard about the organization. And online sources, local presence, and social media have really helped expand that reach. And among those that they surveyed who are aware of Rotary, 35% are familiar with the End Polio Now campaign. So that's there is some awareness and understanding happening there, but obviously still opportunity for us to reach more people. And among those familiar with Rotary, 3 in 10 are somewhat likely to get involved through volunteering and donating. And so we found quite a bit of information around who each of these audience types are and how they want to or will engage with us. So we can go to the next slide. The community activist, the community activist statement is that Rotary has empowered me to make a real difference in my community at a level I couldn't do on my own. I like to see the results of my efforts and look for hands-on volunteer opportunities. And for people in this group globally, participants tended to identify with this persona the most overall. And in terms of country breakdown, the top 4 were Brazil, France, US, and then UK, Australia, and Mexico were all tied for 4th. Next slide, please. The supporter group, the statement is Rotary provides me with valuable social connections and the opportunity to support causes in a way that fits into my busy schedule. I honor my commitments to my colleagues, friends, and family. Korea tended to respond with this the most, followed by France and Poland. Next slide, please. The hand raiser statement is through Rotary, I am able to connect with like-minded professionals, achieve my service goals, and be recognized as a leader in my community. It's important that the world understands the impact Rotary makes. Taiwan identified with that mostly at 26% of Taiwanese respondents, and then Nigeria and Korea as well. You can go to the next slide, please. The traditionalist says, I am proud to be a longstanding member of Rotary. It's important to me that we maintain Rotary's traditions because they contribute to the success and legacy of the organization. The countries that resonated with this the most were Italy, Taiwan, India, and the Philippines. Next slide, please. And then lastly, we have our global citizen who says, Rotary gives me the opportunity to make a difference both locally and globally. I value the opportunity to make friends with people with diverse backgrounds while doing good around the world. And the countries that identified with this most were Nigeria, India, the Philippines, Brazil, and Mexico. So as you can see, we have quite a few different audiences and quite a few people that resonate with different categories of that. So how do we reach them? How do we develop a compelling message? So there are some key elements to help us craft that. And the first is make sure that we have a goal. So be purposeful, define what you want them to do, to take away. The next is to be clear, deliver your message in a way your audience will understand it, making sure that you're eliminating jargon and slang, which can be very difficult to do when you're talking about polio. Be concise, say what you need to say as succinctly as possible. Be relevant, it needs to mean something to your audience. Make sure your message is credible so that it is true and believable. And then be differentiated, stand out, use personal anecdotes and experiences to help connect with your audience and create a more engaging and memorable story. And lastly, test and refine. Keep what works and change what doesn't. So you should always be evaluating your messages to find out what does resonate most with that audience. And I believe we have a few guest speakers today to kind of chime in on things that work well in their area and what they are doing, you know, with their communities and with their audiences. And one of those people that we have today is Denise. And Denise, if you would like to share with everyone who you are, what your role is, and what you would like to mention about crafting compelling messages, I invite you to do that.
Bom dia, meu nome é Denise, eu servi como coordenadora da imagem pública para a região 29 e nós tivemos, e é um prazer imenso estar com vocês aqui nessa manhã compartilhando um pouco do que nós podemos aprender com as mensagens focadas na erradicação da poliomielite. Nós podemos dizer que nós tivemos um grande exemplo de trabalho em parceria e criamos mensagens convincentes através dessas parcerias. Para que nós possamos criar mensagens convincentes, nós temos que, sobretudo, conhecer o nosso público, nós precisamos entender qual vai ser a nossa mensagem, qual o nosso interesse, quais são as nossas preocupações e quais são as preocupações de quem vai receber essa mensagem. As nossas mensagens devem estar adaptadas ao nosso público, né? Então, nós temos que saber para quem nós estamos falando e o que eles querem ouvir. Precisamos também destacar os benefícios, as pessoas estão interessadas naquilo que elas podem colaborar. Nós usamos aqui, durante 3 anos, um programa chamado Telepólio. Esse programa foi em nível nacional, foi em todo o Brasil. Mas esse programa, ele não ficou restrito aos Rotary Clubes. Ele trouxe consigo os rotaractianos, os interactianos, e ele trouxe consigo as provas sociais, que foram as nossas celebridades. E daqui a pouco eu posso falar um pouco mais sobre essa prova social e o como elas foram importantes para o sucesso dos 3 telepólios realizados no Brasil nos últimos 3 anos, aos quais foram arrecadados, além da conscientização pública, foram arrecadados cerca de $360 mil para o programa Polio Plus. Obrigada.
Thank you, Denise. And another one of our speakers this morning is Andre. I wasn't sure if you wanted to, talk a little bit about some of the communication strategies, that you would like to share now, or if you want to hold off on that a little bit.
Thanks, Sarah, and thank you for giving me the opportunity to share what I thought. I'm currently the EPNC for Zones 10B and 10C, that includes Singapore, part of Malaysia, and Brunei. I was fortunately an RPIC until 30th of June 2022. So having gone through the RPIC roles and then now I'm in the EPNC roles, I find that in order for us to be able to reach the target audience in terms of our messaging, I think we need to seek the help of the regional public image coordinators, because I think they are best in doing that, in crafting the right image for the target audience. However, they will need the EPNCs to supply them with statistics and information about this end polio status, because as EPNC, I'm receiving regular updates and reports from the Chief Information Officer, from people like Reg, and I need to share this information to other Rotarians, and what better idea than to share this with the RPICs so that they can help to distribute this and craft out of these reports compelling images that they can actually craft for the different target groups of people so that they can understand. Because today, I'm not too sure about the other region, but in my regions, people seem to think, or Rotarians seem to think, that we have been in this for so long, and yet we are not making progress. But you all can hear just now from the updates from Sarah that we have made tremendous progress in terms of the eradication of the wild polio virus in Afghanistan and Pakistan. We have made a lot of progress. And I'm not too sure how many of them are aware that we are seriously looking at terminating polio or eradicating polio by the year 2026. And what do we need to do that? Therefore, I think the involvement of the Rotary Public Image Coordinator is important, because they will be able to know not only how to craft the relevant image for the targeted audiences, but as well as what media, what platform, and when to actually post those images or publish those, sorry, not images, but communications, and what particular platform, when do they need to publish them. I think this collaboration needs to be made closer. That is as far as communication is concerned. And obviously, the other part is, if we are going to talk about eradicating polio and the fact that sanitation is very important, then I think we also need to work together with the Rotary Foundation coordinator. Maybe increasing and inviting clubs, encouraging them to do global grant projects to improve sanitation in countries like, Afghanistan and Pakistan. So that's my thought. Thanks, Sarah.
Thank you, Andre. Next slide, please. That is a great transition to the next slide, which is choosing effective communications channels. So where will our message be welcome? And each medium has pros and cons, and there are some ways that we can help define what the right channel is for our message. Platforms that align with your target audience and your initiative's goals are key for this. Choosing the right communications channel for your audience can make a big difference in how your message is received, understood, and acted upon. The wrong channel can lead to confusion, misunderstanding, misinterpretation, and even conflict. But the right communication channel can enhance clarity, comprehension, engagement, and trust. It can also help save you time and money and energy by avoiding unnecessary repetition, clarification, or follow-up. So communications can be classified in 3 ways: verbal, written, and visual. Verbal communication includes face-to-face conversations, phone calls, video calls, webinars, podcasts. Written communication includes emails, instant messages or text messages, reports, memos, newsletters, even social media posts. And visual communication includes charts, graphs, diagrams, infographics, slides, and videos. Communication channels find ways to blend these communication types to convey your message. So some various communication channel options with their pros and cons, along with some guidance for selection. We have first traditional media, which includes newspapers, magazines, radio, television, outdoor advertising. The pros for these, it has a wide reach. You can reach a broad and diverse audience with these, particularly through television and radio. They have credibility as established media outlets. They offer you local targeting for your specific geographic areas. But the cons are that there's limited interactivity because it's one-way communication with limited audience engagement. There's not a lot of opportunity to provide clarity in your message, so it has to be really clear and easy to understand. It can have high costs. Advertising in primetime on television or prominent positions in print media can be expensive. And it can be difficult to measure. It can be tough to gauge impact for things when you don't have a back end of something telling you how many times someone clicked on something, or how many eyeballs saw what you put out there. Next is social media. So platforms like Facebook, Instagram, Threads, Twitter, which is now called X for some reason, and LinkedIn offer interactive and dynamic ways to engage with your audience. The pros of this, you have targeted reach. So social media allows you to really define and target specific demographics. We're going through this quite a bit right now as we prepare our paid social media campaigns for World Polio Day. And, how do we want to reach people, and what metrics really matter there. And then engagement, users can interact and share and comment on your content, which really fosters engagement and can improve shareability. And it's also cost effective. Creating and sharing content on social media is generally affordable. However, there is an issue with algorithm dependency. So visibility can depend on platform algorithms, which can change and impact reach. People have a short attention span, so social media users can scroll really quickly through their content, which means you need to capture their attention quickly. And then negative feedback, negative comments or backlash can spread quickly if not managed properly. And that's something that we saw, especially in the fall last year when we re-announced the renewed commitment through the Bill and Melinda Gates Foundation. Bill Gates published something about the partnership on his Twitter channel. And we got a lot of engagement on that post, but not a lot of great engagement because, people get really mad at Bill Gates, or they think, that he's not doing good things. So there were a lot of negative comments on his content. Next are websites. Those are central hubs for information, offering in-depth resources and content. Our mpolio.org site is a really great resource for content if you're looking for information or resources in your area. The pros for that is you have complete control over content, branding, and user experience. You can include detailed information, documents, videos, interactive elements, and a well-designed website can enhance your organization's credibility. And so we're continuing to work on that on the End Polio site with user experience and making sure people can find what they need. The cons for that are traffic generation. You need effective strategies to drive traffic to your website. And then also regular updates and maintenance are required to keep the website current. Next are email newsletters, digital direct communications. Email newsletters are direct communication tools that allow you to reach a subscribed audience, which is great because they have opted in to receive your content, such as the End Polio Now newsletter. The pros for that, it can be personalized based on subscriber preferences. They go directly to subscribers' inboxes, avoiding the algorithm barriers. Email often has a higher conversion rate for targeted audiences, and it's a really quick, immediate method of communication. The downside of email newsletters or digital direct communications is building and maintaining a subscriber list takes effort. We actually just uncovered a little hiccup on our end for our End Polio newsletter that people who were subscribing on our website weren't going into the right list, which is not a fun thing to realize, especially if you don't know how long it's been happening. So making sure that you have good list management. Overuse, so excessive emails can lead to unsubscribes or being marked as spam. Design challenges, ensuring emails display properly across a wide variety of devices, and they can be easy to overlook. You can't guarantee that people will see messages or respond in a timely manner. And then last, I have events on here as well, which can include seminars, workshops, conferences, community gatherings. These are really great for direct interaction. They offer face-to-face engagement with attendees, offering a stronger emotional connection. They offer opportunities to facilitate networking and relationship building, and you can tailor your message to a specific audience based on who attends. The downside of that is logistics. Organizing events requires a lot of planning, resources, coordination. Technology also really important, especially in a post-pandemic world where reliable technology is really important for virtual and hybrid events. Limited reach. If they are in-person only events, they would have limited attendance compared to online channels. And then sometimes geographic constraints if they're location dependent, which could limit access for distant audiences as well. So some quick guidance for channel selection. I think, Andre kind of mentioned this a little bit too, but understanding your audience. So determining where your target audience spends their time and what channels they prefer. Next are your goals, defining clear goals for your awareness initiatives, such as reach, engagement, education, and then leveraging a mix of the channels. So usually a combination of them works best because each has strengths and weaknesses. Consider your budget, allocate your resources based on the channels that align with your goals and audience and your budget. Measurement and adaptation. So set up metrics to track each channel's effectiveness and be ready to adapt based on the data. And then tailoring the content. How easily can you customize your message and content format for each channel to maximize the impact? So the choice of communication channels and platforms really needs to be a strategic decision based on your initiative's objectives and your target audience's preferences and behaviors. A well-balanced approach that uses a mix of these can help you create a comprehensive awareness campaign that reaches and engages your audience effectively. Next slide, please. So leveraging digital communications tools, how can we maximize our reach? I just mentioned that digital tools really can help us in these efforts and how we can best optimize those. Social media in particular has really revolutionized the way businesses, organizations, and individuals communicate and connect with their target audience. Its ability to reach and engage a vast, diverse audience on a global scale is its strength. Some key aspects. So as I mentioned, the global reach, social media platforms have billions of active users, allowing content to reach people around the globe. This global reach enables brands, individuals, organizations to connect with audiences they may not have been able to reach through traditional methods. The targeted marketing, also important. You can tailor your content to specific demographics, interests, behaviors, locations. The engagement and interaction. Social media enables real-time interaction and engagement with your audience through comments, likes, shares, direct messages. You can build meaningful relationships. There's also an opportunity for content virality. Engaging and shareable content can quickly spread on social media, which, expands your message exponentially to garner widespread attention. That can lead to increased brand awareness and recognition. And then user-generated content. So social media encourages user-generated content where your audience creates and shares the content related to your brand. This increases engagement and serves as authentic testimonials. This is something that we are doing on the End Polio side of things more frequently. You may be familiar with the Voices of Members video that we've done historically for World Polio Day. We're turning this into a little bit more of a social media first campaign, where we are finding people to participate and share why polio eradication is important to them, or maybe if they've done some type of a fundraiser or a meaningful story of impact that they have to share, and then sharing those out every month versus creating one video a year. So that is one way that we're doing that. And then if you've taken a look at the World Polio Day registration page for this year, you'll see there's an option as well for you to share your stories. So we're really trying to garner those stories from you as well as the people that are out there doing all of the really good hard work, so that we can help celebrate your successes. Some best practices for leveraging social media platforms, again, defining your strategy, especially on social media, because there are so many different ways to present information. So depending on whether your goal is awareness and you want to reach a larger number of people, if it's engagement and you want to reach a smaller but more engaged audience, if you want people to click through to a website or donate, being really clear about what you want people to do will help you use that channel to the best of its ability. Next is content creation. Make sure you're creating diverse, compelling content such as videos, images, infographics, blog posts, and more. Maintaining a consistent brand voice and visual identity across platforms, and we can certainly share resources for that. Make sure you're posting consistently. Regular updates keep people engaged. Engagement. So a big part of social media is just responding to people's engagement. So when they're commenting or sharing messages or mentioning you, making sure that you're encouraging dialogue. Next is visual appeal. So because people scroll so quickly through social media and you need to capture their attention very quickly, making sure that you're using compelling graphics and visuals. Use relevant and trending hashtags to increase discoverability. Collaborate with influencers, which we'll talk a little bit about, and then consider paid advertising for that as well. Let's see. I think we could probably go to the next slide, Nina. Okay, collaborating with partners and influencers. So how can we amplify our message through others' voices? Partnering with other organizations and influencers can really amplify our message. We can leverage audiences from partnerships that have access to a wider audience base. There's a credibility transfer that associating with reputable partners can enhance your credibility. And then diverse expertise. Partners can bring diverse perspectives and expertise to the table. The difficult side of this is that there can be some alignment challenges. So ensuring alignment of goals and values with partners is very important. Dependency, your message's success can be tied to the effectiveness of your partners. And then coordinating efforts and messages with partners can be complex, but it's a powerful strategy for amplifying awareness and achieving various goals. Each of these groups brings unique strengths to the table. So when you harness those effectively, they can significantly enhance your brand's reach, credibility, impact. Some strategies for establishing collaborations: First, identifying relevant partners. So research and identify influencers, community organizations, and stakeholders whose values align with your brand or cause. Look for entities that already have an audience similar to your target demographic. Next is building those relationships. So build a genuine relationship based on shared interests and goals. Next is highlight the mutual benefits. So how can it clearly benefit both partners? Tailor the collaboration, customize your approach for each partner, and then offer value offer value up front. That could be exclusive access, sneak peeks, promotional offers, or content that's valuable for their audience. And then really clear communication. So establishing open lines of communication for everyone to make sure everyone is aligned. And then I believe Denise had some things that she wanted to share in terms of collaborating with partners and influencers as well. So Denise, I would invite you to share that information now if you'd like.
Obrigada. Eu vou falar um pouquinho da colaboração com parceiros e influenciadores aqui nesse grande projeto que foi o Telepolio, um projeto que foi, como eu já disse anteriormente, executado nos últimos 3 anos, em plena pandemia. Nós lançamos o Telepolio numa união, numa junção de todos os Rotary Clubes do Brasil. É muito importante falar que o Telepolio ele buscou essa parceria de influenciadores, porque nós buscamos a imagem dos influenciadores, das pessoas que têm grande influência nas mídias sociais, e também a imagem dessas pessoas associadas à nossa luta mundial contra uma doença que afeta todos no mundo todo, com um fundo humanitário muito forte. O Telepolio foi uma ação que utilizou deste recurso e teve pronta adesão de celebridades que aceitaram o desafio de imediato, de pronto, para participar da nossa campanha. E o surgimento das novas formas, de novas celebridades formadas nas figuras públicas, nos bloggers, nos digital influencers, eles também observaram que podiam dar a sua prova social, a sua força, o seu alcance a causas nobres e sociais como as nossas, como a nossa causa, que é a erradicação da polio. Primeiro nós procuramos formadores de opinião, figuras públicas de destaque na comunidade, para que essas pessoas pudessem propagar e amplificar a nossa mensagem. Essa foi uma troca colaborativa, foi um empréstimo do prestígio dessas personalidades à campanha e à imagem delas associadas a uma causa. Como, por exemplo, nós buscamos personalidades intrinsecamente ligadas à doença, como foi o caso do jornalista Boris Kazoy, um jornalista de renome nacional que sofreu da polio na infância e superou. Sequelado pela polio, âncora de diversos telejornais brasileiros, uma figura amplamente conhecida em todo o Brasil, ele se juntou a nós nos 3 últimos anos no Telepolio. E também outras personalidades se juntaram à nossa causa, como, por exemplo, o cantor Michel Teló, um cantor filho de rotarianos, que emprestou a sua voz e a sua imagem. Eu poderia citar outras celebridades, como a Rebeca Andrade, por exemplo, uma ginasta. Nós também tivemos aqui conosco figuras do esporte, figuras da arte, da música. O que essas pessoas trouxeram para a nossa campanha? Trouxeram a chancela de que elas acreditam na nossa promessa à humanidade, que é erradicar a polio. E nós podemos usar como estratégias, como, por exemplo, postagens colaborativas no Instagram. Trouxemos influenciadoras como as Tri Marangoni, meninas que representam a Adidas aqui no Brasil. Essas meninas, Trio Marangoni, uma das meninas era a nossa assistente na imagem pública, e elas estavam em diversos canais, no Instagram, no YouTube, no TikTok, e elas também passaram por TVs abertas em mais de 15 países. O que essas meninas, o que esses influenciadores trouxeram para nós? Chancelaram, validaram a nossa causa. E por último, eu podia dizer que o trabalho desses influencers com a nossa instituição está no fato deles entrarem em espaço que muitas vezes outras formas de publicidade não entrariam. O influenciador que está no Instagram, que está no TikTok, que está em outras mídias sociais, ele colabora, ele faz com que pessoas externas possam assistir a um depoimento delas para se juntar a nós, no trabalho, antes de dormir, na fila de um banco, ou seja, é uma forma moderna de alcançar públicos que muitas vezes a mídia tradicional já não provoca mais. Obrigada.
Thank you, Denise. Wonderful. And then I think we could probably, I know we only have 7 minutes, so we can hop into this last point and then we'll address some of your questions. So the last one is measurement. And sometimes this gets overlooked, but you need to remember this final step. Your story requires a clear call to action that tells the audience what they should do next, make it clear and compelling, and then do research to make sure you're evaluating how well things are working. You can ask for feedback from your audience through surveys, polls, ratings, comments. You can track quantitative indicators of your communication performance, such as open rates, click-through rates, using analytics tools or dashboards. You can review qualitative outcomes of your communication, such as behavior change or action taken through case studies or stories. And you can assess your results by comparing before and after scenarios, using indicators such as return on investment or key performance indicators or SMART objectives. Evaluate your channel's effectiveness through all of those feedback and through those metrics. So for example, just kind of to loop things back here, when Rotary launched its Polio Plus program in 1985, 1,000 children were paralyzed by polio daily in 125 polio endemic countries. Today, we have just those 2 wild polio endemic countries remaining, Afghanistan and Pakistan. And in a lot of ways, that's a direct result of effective storytelling. And we've heard some examples of that today. So knowing we have just 5 minutes left, want to make sure we have a little bit of time for Q&A. We had some questions that were submitted. Nina, do you have any? Go ahead.
Yeah, I will stop sharing the slides for the Q&A. We had the list of resources, but I just want to let you know that we will send all those resources and the recording of this session for you in the follow-up email. So looking at the resources, you probably won't remember all of them. So you will see everything in the email. Yes, I do have the list of some of the questions. So I guess I'll start with the questions to our panelists. There's one great question that I think Denise and Andre can help to respond. How do we collaborate with ARPICs to be able to get help from EPNCs? And I guess Andre kind of put a lot of information. Denise, Andre, anything else to add? Maybe like collaborating with others, because another question that we have here is also how can the RRFCs assist the EPNCs in their efforts?
Can I share my thought on that?
Yes, Andre, Denise.
Yeah, okay. So yes, I think that is a very good topic about collaboration between the EPNCs and RRFCs with ARPIC and even as well as with the RCs, the Rotary coordinators. In fact, what I have done is that, as you all probably aware, we need to raise $50 million every year, right? So that we can get a matching of $100 million from the Bill and Melinda Gates Foundations. Now, if we just take 1.2 million Rotarians, not counting the Rotaractors, and we take 50 million divided by the 1.2 million, each member is supposed to be like about $42 of contributions. So what I did was to work with the Rotary coordinators in my zone to find out what is their forecasted membership in the zone. And I multiply that by $42, and that will represent the goals of the Polio Plus that needs to be raised in this Rotary year. And that figure can then be passed on to the RRFCs for them to include that, to add it as their total contribution towards the Rotary Foundation for this particular given year. And then maybe perhaps we can also pull in the EMGA to see whether some of those fundraising efforts that they have in plan can be allocated part of it towards Polio Plus. Although I know that EMGA focus is for endowment and major gifts, but I think maybe we can perhaps ask for their help to see some of it can perhaps be considered giving it to Polio Plus. So this a network of collaboration, I think, is very important. And as well as with RPIC, as I mentioned, because we need the RPIC to help us increase advocacy and awareness, not only among Rotarians, but as well as members of the public in crafting compelling messages that can resonate well against the targeted audiences that we have in the landscape. So that is what I can share, Nina. Over to you.
Great. Thank you so much. Let me go to some other questions. Denise, that will be a question for you. How to deal with polio fatigue or why spend all this money for only 6 cases among Rotarians?
This is the Italian interpreter. Since the channel is not available because of Zoom, the last 5 minutes, I will say it in Italian if you don't mind.
Okay.
Quindi una domanda che dice, ma se ci sono solo 6 casi, perché spendere tutte queste risorse?
Muito obrigada pela pergunta, Nina. O que nós aprendemos com os esforços, com os trabalhos conjuntos, com os coordenadores do Ende Apolional, com a força-tarefa que trabalha com a questão da erradicação da polio, é de que a poliomielite, muitas das vezes, ela não apresenta sintomas, assim como o coronavírus, né? Às vezes a pessoa tem o vírus é muito agressivo, o vírus é muito contagioso. Então, enquanto nós tivermos um único caso em qualquer parte do mundo, é perigoso para toda a humanidade. Então, nós precisamos chegar no zero, nós precisamos eliminar esse vírus da face da Terra para que ele não cause danos, não cause consequência a ninguém, a nenhuma criança. Então, é por isso que nós temos que lidar com essa fadiga da polio e gastar, investir realmente recursos financeiros, recursos humanos, para que nós possamos eliminar a polio. Para vocês terem uma ideia, cerca de 80% das pessoas que têm o vírus da polio, elas são assintomáticas. Então, assim, quando se chega à paralisia infantil, é um percentual muito pequeno, como se fosse a ponta da pirâmide. Por isso, todo esforço é muito válido, todo esforço é vital. Acho que respondi, Nina. Tu corri um pouquinho por conta do tempo.
No,
spero di non aver parlato troppo, però io come interprete vi abbrevierò quello che ha risposto. In pratica, fino a quando solo un bambino al mondo sarà a rischio di questa paralisi, di questa terribile malattia, di quello che noi sappiamo, è una fatica in tutti i rotariani, tutti coloro che hanno già lavorato in questo senso, e naturalmente dobbiamo combattere questa stanchezza, questo non voler continuare. Bisogna combattere fino a quando avremo raggiunto ogni bambino, avremo eliminato dal mondo questa terribile malattia.
Thank you so much, Gabriel, Marie, Ren. I see your hands. Unfortunately, we will not be able to accept those questions. We really had 29 questions submitted, and we have just few behind the time. Sarah, I have one question for you. Can we still use the EPN? I think it's an important question to ask.
I think I need some clarity on what that means. The logo?
Yes, I think
use the EPN logo. It's still on the Brand Center. It's available to download. There are logo lockups available. I know a couple people asked some branding questions, and I'm happy to help provide some answers to Nina so that we can follow up via email with some of those questions. But yes, you can still use NPolio now. We also have on the npolio.org website Together We End Polio tagline graphic that you can incorporate into materials available for download. So I would say your first stop should be endpolio.org for any brand resources.
La domanda era, possiamo usare ancora il End Polio Now, il simbolo ENPN? E sì, la risposta è sì, però naturalmente il posto ideale per tutti i lock-up e tutto quello che è il messaggio per quanto riguarda End Polio Now e il materiale, insieme possiamo eradicare la polio, per esempio la nostra tagline, possiamo farlo utilizzando appunto il sito web con tutte le sue risorse.
Thank you so much. Gabriel and Irene, please put your questions into the chat so we can respond to them later.
Gabrio e Irene, per favore scrivete le vostre domande all'interno della chat, perché più avanti potremo rispondere con calma con una email. Grazie e ci scusiamo per i problemi tecnici.
Question to Claire, how we can encourage districts to donate their DDF to polio?
Come incoraggiare i nostri distretti a donare il loro FOD per End Polio Now?
One, you can look to see how much DDF they have available and encourage them to give a portion. Not every district will want to do 20% right at the beginning. So maybe ask for 10 at the start of the 10% at the start of the year, or ask a district governor in the DRFC to match club contributions for a limited period of time. Is a nice way to encourage giving, so that they can also set a limit on it. So they could do, we will match contributions up to this dollar amount, and then once that amount is reached, they make the DDF allocation. And also, if there is any leftover DDF at the end of the Rotary year, encouraging districts to give all or a portion of that money to Polio Plus is very helpful. Rotarians and the general public did not give to the annual fund for it to sit in a district's DDF account. They gave it to be used on projects, and so why not support Rotary's #1 project and priority of polio eradication?
Io comincerei da quello che è stata la conclusione finale. Se i rotariani hanno fatto delle donazioni per il Rotary, non sono queste donazioni indicate per rimanere nei vostri conti distrettuali, quindi sarebbe il caso di collaborare, chiedere di collaborare con DRFC, con i governatori, per indicare magari la donazione, alla prima donazione del 10% del FOD, indicare che raggiunta quella somma poi saranno equiparati i fondi disponibili sempre alla fine dell'anno rotariano per End Polio Now, perché appunto l'eradicazione della polio dovrebbe diventare prioritaria, ma non è detto che tutti siano d'accordo per quanto riguarda il 20% del FOD. Questo è soltanto un sommario della risposta.
Thank you so much. I think we have to stop because we're already 6 minutes behind. And as I said previously, we received 29 questions during the registration. So we will work with Sarah and Claire on we'll come together and find the way how to respond to those questions and deliver those answers to all of you. Also, if you had questions, we will check the chat and we'll respond as well. Sarah, any final words?
Just thank you all for being here today, and I hope you were able to take something away. And do not hesitate to reach out to me anytime if you have questions or ideas. I don't think I actually introduced who I am. I'm the Polio Plus team lead for communications. So this is my wheelhouse. This is where I live all day, every day, is in the polio realm of things. So I look forward to hearing from you and working with you.
Thank you so much. I also want to say a big thank you for joining us today for Denise. She was a past ARPIC, and she is a champion working with polio and EPNCs. Her projects are amazing. So reach out to her as well for expertise. I also grateful for current EPNC, Andres Soarte, who also was the ARPIC that I had a pleasure to work with, who had plenty of knowledge, kind of combining together. He's a great resource as well. And as I said previously, we're going to send the recording of this session in languages and as well the list of resources. And we will try to include maybe the answers to some of the questions. Thank you so much for your participation. Sorry for us being a little taking more time than we planned to, but I guess we have plenty of information to share with you. That's why you have plenty information to be prepared for the Polio Day in October. Thank you so much for participation.
Stay healthy, everybody. Andre.
Bye.
See you. Bye. See you soon.
Bye, Uncle Randy. Good
Yeah.
to see you.
Tchau, obrigada. Thanks, Nina. Thanks, Sara.
Nina, valeu.
Tchau.
Thank
Tchau.
you. Bye bye.
Valeu,
Tchau,
Au
Dani.
revoir à tout le monde. Bye bye. Au revoir.
See you. See you, Avó. See you, Ashley.
Obrigada,
See you,
Érica.
Carlos.
Bye. Bye.